throughout this decade, there have been discussions in the United States on how to improve healthcare in the United States. Senator McCain is proposing a tax incentive that, through various sources that I've read in factcheck.org, have raised more doubts than answers. Senator Obama has an idea that health insurance should be like automobile insurance. We have to buy it whether we can afford it or not. Some other groups are proposing socialized medicine, and they point to Canada as a good example of this. Some of them even have fond memories of earlier this decade when senior citizens and other groups took bus trips north of the border, paid a visit to the local Canadian pharmacist, and bought the prescriptions there, where at that time the prescriptions were a lot cheaper in Canada than they were in the United States. As Diane had mentioned to you, one of my hobbies is research, and well, I happen to dig enough, or try to dig enough information to persuade you that socialized medicine, or at least the Canadian-style version of it, is not exactly a good idea, and here's why. Best way for you folks to understand socialized medicine is to understand the history of Canadian socialized medicine. It's been in existence since 1967, and the current form of it, the Canada Health Act, has been in effect since 1984. It was a result of modifying a couple of laws that have been in existence. For more further, I'm going to summarize what's happened. For more further details, there is a website to the Health Canada website. The idea happens to be that the only thing you need to pull out of your wallet when you go to the hospital or go to the doctor is just your insurance card. There's five following criteria. One of them is publicly administrated, and that's done through the provinces, not through the federal government. When you settle down in Canada or as a Canadian citizen, what you need to do is file the appropriate forms with the provincial offices in Ontario. That would be Toronto, and British Columbia, that would be Victoria, and so on and so forth. Second thing, all health services are covered. A little bit vaguely defined what health service happens to be, but whatever it is you need, and if they have it, they're going to try to give it to you. Third, those who are covered by the insurance, and not every Canadian is covered by the Canada Health Act provisions, which, by the way, in Canada is also known as Medicare. Those not eligible happen to be those of the Royal Canadian Mounted Police, Indian tribes, and of course, anybody that happens to be incarcerated. They have to have their own health plan to deal with. Whoever you are, if you're part of the plan, you're covered. Portability. That means if you happen to move from one province to another, you're covered by the new province. However, when you move, you have a 3-month grace period to register with the new province in order to get the health insurance, because the health insurance provisions are provincial, not federal located. If you fail to register within 3 months, then you're considered uninsured, and you're going to have to pay the bills like uninsured Americans in this country. Portability also has its limits. If you don't like the medical care in Ontario and need to go to and decide that you might as well visit your favorite doctor or what you think would be a better hospital in Quebec, they won't allow you to do that. It would be the equivalent of Senator Kennedy being told that his brain surgery and all his exams to deal with brain cancer would have to be done in Massachusetts, whether it be Boston or Springfield, rather than Raleigh or North Carolina, where he happened to have his surgery, and thank goodness he's doing well. Number 5, access to services. They have access to the services when and where available. In socialized medicine, there's also another problem. Not only does the government determine or not determine what health services really are, but sometimes they determine which hospitals have or don't have appropriate medical services. In Windsor, Ontario, believe it or not, if you happen to have a heart attack, you're not going to get cardiac care at either of the 2 Windsor hospitals. You're going to have to go to Detroit. In November of 2007, it almost ended up with tragic results. There was a gentleman who, 46-year-old man, had a heart attack and had to be shipped over to the nearest hospitals in Detroit, where they had cardiac care. And the deal between the American government and the Canadian government was that the Canadian healthcare services was to fax information to the customs agency. Customs agency was to review it and wave the ambulance right on through. Unfortunately, in November of 2007, that didn't quite happen the way it was supposed to. The customs agent didn't quite understand what was going on, stopped the ambulance at the border, did what they call a secondary inspection, which they physically inspected the ambulance and asked the poor gentleman, are you who the ambulance company says you are? He was somewhat losing enough to respond yes, and he was on his way to the hospital. Fortunately, he recovered, and as expected, the Ontario government wasn't happy, and of course the gentleman's girlfriend wasn't quite happy either with the whole service, and they're both looking to improve communication between the United States and Canadian customs and all other appropriate agencies. As I also mentioned earlier, portability is also quite a problem. There was an 86-year-old gentleman who lived in Saskatchewan. He fell and broke his hip, or he broke his hip and fell. At his age, it could be either way. His doctor realized there were no hospitals nearby his house in Saskatchewan, so they had to ship him. So he decided he needed to be shipped over to a major hospital in Calgary, Alberta. The Calgary hospital looked at his records. It wasn't a major emergency. He wasn't vacationing. He didn't move to the Calgary area. So the hospital said, no, you are going to go back to the hospitals in Saskatchewan. Unfortunately for this gentleman, between his age and the stress of dealing with the bureaucrats and moving from hospital to hospital to hospital, he died along the way. That's just a couple of examples that I can give to you, and the examples I gave you came from the CBC website, and when you go there, what you could do is use the search term Canada Health Act, and then we'll pop up those two examples along with some other ones. With the research that I've done, and I wish I could share some more with you, but time is not permitting me to do this. There's ways to fix the American healthcare system. However, after looking at the Canadian system, I'm not exactly convinced that Canadian-style socialized medicine is the way to go. Thank you.